Dear Chair, dear participants, good morning everybody. I will present you last grade nursing and midwifery student recognition levels signs of violence against women. As you know, violence is a global problem and violence has been increasing in the world. Violence against women is a major issue, especially in Turkey. And we can define the violence as a public health problem. The prevalence and types of interfamilial violence against women change in the world, in the countries. But it is a common problem experienced by women in all population, various strata of communities and through the world. According to the United Nations report, women suffered from violence, especially physical or sexual violence in any period of life. As you see, rates are changing from 77% in Canada and 71% in Ethiopia. It's changing rate. In a report issued by the World Health Organization in 2014, it was stated that experienced sexual harassment during childhood, 1 out of every 5 women, and victim of physical or sexual violence, 1 out of every 3 women. It's very important data for us. And violence causes a lot of health problems, health effects, acute effects, chronic effects, and what a pity, deaths. Health personnel should interview, appropriate language, and giving confidence to reveal the violence, diagnose cases of violence, and making risk assessment, and provide information about violence, legal, for example, legal rights, security, and social support systems, and communication networks, and keeping related record. It's very important. Because there is no record in Turkey, and reporting and notification and community race awareness, it's very important. Healthcare should be. And healthcare personnel encounter victims of violence everywhere, every time. And violence isn't diagnosed enough by health personnel. Diagnosis rates are very low in Turkey. The aim of the study is determine the level recognition signs of violence against women, nursing and midwifery students. And this study is a descriptive study. And we involved nursing and midwifery students at Ege University and Celal Bayar University, last grade students. And data were collected by using descriptive characteristic form, and nurses and midwives to recognizing symptoms related to violence against women scale from. And you can see that we use scale. Scale name is scale developed by Baysan and Baysan Arabacı and Karadağlı 2060. And scale consists of 31 items, and there is a 2 subscale: physical symptoms and emotional symptoms. And lower scores demonstrate that the ability to recognize symptoms of violence against women was insufficient. Also, ethic permission was taken from Ege University Nursing Faculty, and we use SPSS package program for data analysis, demographic analysis, and Kruskal-Wallis and Mann-Whitney EU analysis. As you see, the average age of students was 22. 86% of the students are female and 14% are male. 74% of nursing and 25% of the midwifery section of students. And this data is very important. 24% of the students were exposed to violence, especially emotional violence. And so, 94% of the students had information about violence against women. 80% of students diagnosing the symptoms of violence against women find enough itself, and 41% of students have received training on violence, and 23% of the trains was found partially sufficient education. And when the points are evaluated, students' knowledge was found to be partially sufficient. As you see, physical symptom subscale 80 points, emotional symptom subscale 11 points, and the average total score of scale 20 points. And female nursing department receiving training violence, explore the violence status, notification to violence of the students, and 20 to 24 years of age group between the subdimension and scale total score was with significantly difference. As a conclusion, we can say that if health professional levels of identifying the symptoms of violence very increased, early intervention, early diagnosis and therapy, rehabilitation, and support for a prolonged period of time, it's possible for health care personnel. In order to the signs of violence, planning of undergraduate training of postgraduate in service training for nurses and midwifery, and perform intervention early related to be to the prevention of violence against women, and placing more emphasis on this issue in the curricula by correcting the deficiency and increase the awareness of students about the prevention of violence, and that provide information related to the projects. Thank you.